Let's talk about what's happening in India, shall we? In the past few hours, the number of cases of COVID-19 in the country has passed 20 million. Authorities in Delhi have asked the army to help tackle the second wave of the pandemic in the country, which is suffering from an acute shortage of medical oxygen and other supplies, with hospitals saying they are struggling to admit patients. Dr. Nilesh Parmar is a dentist from Southend and is desperate to help. Good morning, Nilesh.
Good morning.
Your sister lives in Mumbai at the moment. So what is she telling you about the situation there?
Yes, she does. There's quite shocking news and images coming out of Mumbai at the moment, and also Delhi. A few things I would share with the listeners is many hospitals are running out of oxygen. Quite a large children's hospital in Delhi this weekend was, I think, 40 minutes away from running out of oxygen. The people of Delhi are even running out of wood for cremation. It's horrendous what's happening in India right now.
And of course, this will have a knock-on effect, not just on those patients who are poorly with COVID, but right across the health service.
Yeah, it's almost a humanitarian crisis. You have people who don't have enough food. A lot of the workers in India live from hand to mouth. So the money they make that day is what they use to buy food in the evening. So not only do you have a COVID issue, you have an entire humanitarian pandemic. People can't afford to eat. People can't afford to drink. People can't afford transport. It is plunging into chaos over there at the moment.
And just so our listeners understand the way the health system works, there isn't really a universal healthcare system, is there? It's pay up front for almost any treatment you require.
Yeah, Rachel. So one of the key things, and I think one of the differences that perhaps we here in the UK don't quite understand is here, if you call an ambulance will turn up, you'll be taken to a hospital and you'll be treated. And that treatment would be for free. And the medicine and the oxygen and everything you need is provided by the hospital for free. In India, you have to pay for everything as you go along. Most things need to be paid up front. So, for example, many loved ones whose family members are in hospital with COVID, they need to search the streets, literally looking for oxygen cylinders to buy, then physically dragging those oxygen cylinders to the bedsides of their loved ones so they can be connected up. Same thing with medication. If the doctor says you need, let's say, 3 different types of medication, the onus is on you as a loved one or a partner to go to the pharmacy, physically purchase the medication, and then give it to the hospital to use on your loved one.
It's unthinkable, really, isn't it? From our experience over here, watching what's happening over there. I know you're desperate to help. What, practically speaking, can you do?
So it is very difficult. And I know myself, a lot of healthcare colleagues, we all have family in India. It's difficult for us to go over there at the moment because of the restrictions in flights. I set up a Just Giving page where the aim was to raise £5,000 and then disseminate that money to charities that we know are doing very good work in the ground through my sister who works as a humanitarian in Bombay. Now, we actually are now close to £30,000 in 5 days. The response from the UK healthcare community has been exceptional. So we are trying to do what we can. And I think every little donation we make may save a life in India. So we do what we can, Rachel.
Yeah. And I know the G7 nations, as you know, foreign ministers, representatives from those nations have been meeting this week. Presumably, you would like to see more leadership from the international community.
Correct. I think initially I thought we could have a sort of NHS global arm which could go to different countries to help them in times of need, especially disease or pandemics. But when you reframe that, if you look at the population of India being 1.39 billion people, anything which we could do would merely be a drop in the ocean. If you think the last time all the countries of the world got together, perhaps they formed something like NATO, and maybe now we need a global healthcare task force with all the developed countries of the world getting together and having a combined, coordinated response to pandemics such as this. Because as we all know, unless we're all clear of COVID, we are still at risk from COVID.
No, absolutely. Even if we're very selfishly motivated, that phrase, no one is safe till everyone is safe, is absolutely paramount. And just if people did want to contribute to your fund, where can they find you?
If they find me on Twitter at Dr. Nilesh Parmar, the links are on there.
Okay, thank you so much, and best of luck with all the work you're doing, and all the best to your sister as well. Thank you for talking to us.
Thank you very much.
That's Dr. Nilesh Palmer. He's a dentist in Southend, but as I mentioned, his sister currently based in Mumbai.